Hello, and welcome to today's episode of Health University, where I have the good fortune and pleasure of speaking with Rose McKenzie. She is a medical affairs specialist at Mira, and Mira is one of the most recommended in my area ovulation predictor platforms. It's not an OPK, it's much more than that. It is your fertility and reproductive health platform. And I won't try to belabor that more. I'm going to let Rose describe better what she can, what Mira can do for you. But a little bit more about you, if I may, Rose. You are the medical affairs specialist at Mira, and you help people like myself, practitioners and coaches and OBGYNs, work with our patients using Mira to help both of us better understand what's happening in a woman's cycle. Did I get that correct? And if not, please elaborate for us.
No, that's correct. So Mira is direct to consumer, but we also recognize the provider's role in that journey. And so we want to assist the providers who do want to know their patient's hormone and how the woman is tracking them and how they can assist in that. And so we now have two branches where we're helping providers and also helping the patients directly.
Mm-hmm. Great. Well, I'm going to, as I mentioned, or just off camera, I'm going to say the quiet part out loud, because I think that this is what everyone's question is. Tell us what is different about Mira and why Mira over, the OPK at the grocery store.
Sure. Well, I think what we have to talk about first is what is an OPK, or ovulation predictor kit. Mm-hmm. So it's tracking LH. So some people know it as an LH test kit. So those are the same thing. Mm-hmm. And as its name implies, it is an LH only test. Right. So when we're tracking LH, we're looking for that luteinizing hormone, which we're going to back all the way up and talk about, well, what does that even do? Right. So LH is the trigger or the signal that tells the ovary to release a right egg. Mm-hmm. So that is very helpful for a woman to track and understand, but that single data point may not be enough. So what are the hormones surrounding LH? Are they functioning correctly? Are they balanced? Are they operating at the correct time in the cycle? And so just seeing LH is probably not enough. And that's why we test much more than that at Mira. So go ahead.
No, tell me what else you're testing.
Yes. So Mira can track LH, estrogen, progesterone, and FSH.
Great. And when would a person begin and why?
So anyone can begin tracking their hormones at any point. So you could begin testing tomorrow. Mm-hmm. It could be mid-cycle. It could be that you just finished your period when someone traditionally starts testing their hormones. But really, you can begin testing at any point. And because we see all three or all four hormones at one time, we can really find out where you are in your cycle, what is happening or what just happened. And so we can tell if you've already ovulated, you're about to ovulate. And we see that what we call the full cycle mapping, the interplay of all the hormones.
Right. So whereas if someone's just taking the LH kit or the OPK kit, they pretty much have to have other indicators or an idea as to when they might be ovulating. Otherwise, you're using a kit, every day of your cycle.
Every day.
which is silly. And there is a patient population, a client population, a person population for whom an LH surge is not equal to ovulation will happen in the next 24 to 36 hours. And that can be frustrating at best, devastating at worst when months and months go by and everything looks fine on the kit, but she's not. And I'm going to use the term she, forgive me, audience. She's not falling pregnant that cycle. So tell me how the platform helps this woman understand her hormones better.
Yeah, so we're all about empowering the one to understand her hormones. So we have educational pieces that teach the importance of estrogen. So that's the beginning hormone that kind of starts the process. So rising estrogen levels traditionally were tracked. If someone was tracking their hormones, it was indirectly monitored with things like cervical mucus. So that's how women notice their rising estrogen. Mm-hmm. So many women have been monitoring their estrogen for a long time, just indirectly.
Right.
Now, when we're using these urine metabolites, so we're tracking E3G, these women can actually watch their E3G levels rise leading up to that then LH surge. Mm-hmm. And so they should go together very nicely like that. Rising E3G as E3G is climaxing, then LH should begin to surge and climax.
That's, yep. And then ovulation. And then how much later than the ovulation period time frame would someone expect to see progesterone levels?
Yeah, so I actually want to talk about the LH climax first, because
of course,
that is a big difference between us and LH test strips, where LH test strips, you may just see a day of positive, maybe 2 days, 3 days of positive. And so you can almost graph it, but with Mira, you actually graph your rising and falling LH in quantitative amounts. And the reason why that is important is, unlike some things that you and I mentioned earlier, a flashing smiley face at you, and why that's not as helpful, that only tells you that LH is rising, but it doesn't tell us when it's climaxing and when it's falling. And those two things are just as important as when it begins to rise.
If not more important.
If not more. Yeah.
They are the,
Yeah. And so you might find abnormalities, for example, if someone has more than 3 days of a positive LH test strip, or that lasts for more than 3 days. Or on the reverse, you may find an abnormality if you can't find a change in your LH. And those two things, Mira will be able to find what's the actual underlying pattern. Is it that your LH curve lasts for 4 days, 5 days, or is it elevated even longer than that? And those would be abnormal things that should get addressed. Or are you actually having a small LH change that's not being caught by traditional LH test strips? So to go ahead.
No, I'm interested. And I think where I was like thinking, oh, Mira does quantitative. So this person is not just seeing that hormone is present, or that it might be present in a larger volume, because this, it's going from smiley blinking to smiley static, but they're seeing actual numbers.
Yeah. So that becomes really important, because traditional LH test strips read positive at a hormone level of about 20. But we see patterns where women ovulate with a lower threshold of LH. So each person is different, and each situation is different, and even each cycle can be different. And so some abnormal hormone patterns, such as PCOS, you may see a suppressed LH surge. So we have case studies and examples where women did successfully ovulate where their LH only rose to a value of 15.
So they didn't know they ovulated and missed that
the
opportunity.
Yes, because a traditional LH test strip would not have caught that small of a change.
And and even another test strip that would also test progesterone, well, that's too late in the game. I mean, that's just almost insult to injury, if you will.
Yes, exactly. Yeah. So you missed it, but you don't know when you missed it. So that can be frustrating in so many ways.
Yeah. So, and you mentioned PCOS, and that is the classic example of a person who is just struggling to identify a positive ovulation and know when it's go time, is what I like to say. But then we also had mentioned a little bit off camera the idea of these secondary fertility issues, which is to say that a person has successfully gotten pregnant, carried a baby to term, healthy, mama, healthy baby. And then when she's ready to try again, she's struggling and doesn't know why. How can Mira help that person?
So tracking the hormones is always important, no matter which situation you're in, because your hormones change. You were a different person today than you were when you conceived 2 years ago, 5 years ago, 10 years ago, 15 years ago. You're a different person. And your hormones we have to go back to the basics. Are you having a balanced hormone pattern with E3G rise, an LH surge, and then rising progesterone after? Are they balanced? Are they healthy? And if they're not, then we need to start there.
Yeah. And again, we had a little conversation off camera, but what are some of the reasons why a person might struggle with secondary fertility challenge? In your coaching, you are a fertility coach, by the way. I did not add that you are certified in the Marquette method and the symptothermal method of natural family planning.
Yeah.
So you've done a lot of coaching with individuals to help them identify what's gone a little sideways in their cycles. So back to the question, in your experience as coaching, what have you found to be some of the perhaps contributing or exacerbating factors?
Yeah. I think we could list a lot of things here, but lifestyle changes, the age has changed, their environmental exposures. Have they had an illness? Have they had a change in potentially insulin resistance or underlying other hormone abnormalities? You and I discussed ferritin levels, vitamin D. There's so many things we can go into here. That's why
antibodies, autoimmune antibodies,
yeah,
and very common postpartum, much more common than I think that we are led to understand.
Yes, or other types of inflammatory processes, and that the sky's the limit with that.
Yes. We talked about that we're all coming off years of infectious diseases, and it just lends itself to reason that is a variable that can be considered in an inflammatory process that might be the impediment to a healthy cycle, ovulation, the implantation, and so forth.
Yeah. So what I always like to do in my coaching practice is I go back to the basics and I ask questions like, have your periods changed? Are you bleeding the same amount of time? Do you now have heavy periods, painful periods, PMS symptoms? Are there any abnormalities or red flags within your cycle? And then we look at it along with the data. So the hormones that we're getting from the Mira monitor, which are so beautiful to then see when you started developing PMS symptoms, your estrogen is higher than it used to be, and we can correlate those things together.
And then, as a coach, are you able to, make recommendations for what a person might do differently? So, is there anything in general? And I know that's probably that's a loaded parentheses around the in general, but is there anything in general, I'll dare to say it, that you find to be probably the most common environmental or lifestyle factor today that may not have occurred 5 years ago, pre-pandemic?
Well, I think what I can touch on is the most common thing that I see that's an abnormality.
Okay.
So when my couples are trying to conceive and I look at their Mira charts, the most common thing I see is clinical signs of low progesterone, and then their Mira data backs it up. So as a coach, I can't diagnose them with anything.
Right.
But I can equip them with information to take to their provider and have a very candid conversation with their provider. And they can say things like, I am concerned I have low progesterone because... And they have multiple reasons and evidence, and they can show it to their provider and have a very good conversation. So I feel like I empower them to advocate for themselves in that.
Beautiful. It's a little bit of a conundrum on my sort of coaching or doctoring side as well. I'm not a medical doctor. I'm a doctor of acupuncture and Chinese medicine. So I work very closely with the OBGYN and the reproductive endocrinology community, and because many of my women are considering IVF or egg freezing. And what I will say is, in my experience, it doesn't hurt to give a little progesterone, provided that the person's sort of, mental and emotional capacity can sustain that. It may not, if it doesn't guarantee pregnancy. And you could back up to say, as many of the docs will say or have said to me, what's the reason that there's low progesterone? It probably was not a viable egg. But that's where, again, I'll put brackets around probably. And just, I'm not a gambling person, but I would say, what's the downside in giving a couple of weeks progesterone to give that embryo, a chance?
A chance.
Yeah.
I agree with your philosophy there. What's the hurt in some bioidentical progesterone that their body's already naturally producing?
Right. And we are designed to clear it. I mean, there is this concern about, hormone accumulation, and what will that be like, and how will that affect my next cycle? It, in my experience, 24 years of doing this, it does not. We clear it when the signals are that a pregnancy hasn't occurred, progesterone will clear. There are conditions, and you had mentioned some of them, like a PCO, a metabolic issue where estrogen may not clear as well, but that's a whole different conversation, and I'll have you back for that one. So I really want the listening audience to understand that Mira, unlike other OPK kits or whatever, has really done a deep dive in research. And could you speak to some of the research, collaborations you've done, with whom, and what are some of the results that has been determined as a result of people using Mira and then a control group not?
Yes. Thank you for bringing that up, because we do like to discuss how our technology is very different. So when we say we give quantitative amounts, that's because we're using the superior type of technology called immunofluorescent labeling. And think of that as what hospital labs use. So we call our product an at-home lab, and we mean that. It's a little mini lab that you have at your home. And the difference between that and most other technologies that give hormone values is they're using the older technology called nanogold, which is the color. So most of us know, you dip the dipstick and then you see the color appear. And the darker the color, the higher the hormone compensation. Mm-hmm. And so that's not the same technology we use, which gives us the ability to have this more specific data per person.
Mm-hmm. Could you repeat the technology again? Because I want to make sure that listeners hear it and maybe they want to, investigate it.
Sure. So we use immunofluorescent labeling, and the traditional technology that's used is nanogold.
Okay. Immunofluorescent labeling. Thank you.
And yes. So they're very different in the sense that one is a darkening, and when you see darkening of a color to give it a number value, you can't get enough colors to get so specific to give a number, right? Mm-hmm. So that's why we moved to a different or a better technology that gives us the ability to find those very specific numbers. Mm-hmm. Now, I'll be very open and honest with your audience. Sometimes that amount of detail can sometimes alarm people when they start tracking their hormones and they see these fluctuations, and is this normal, not normal?
Beautiful. So, actually, yes, let's speak to that, if you will, because that has been a question that has been raised to me in clinic. And I'd love to hear your answer. I hope it correlates with what mine has been.
I hope so too. So I think to do justice, we have to talk about really quickly how we test, because some people might not know right now. Are we testing dry urine, wet urine? What are we doing? Mm-hmm. With Mira, you get an analyzer, and then you get daily one-use wands. And the individual collects a concentrated urine sample, which means they haven't peed in the last 4 hours. Logistically and habitually, the easiest thing is first morning urine. It's naturally concentrated. And you begin then each morning dipping a wand. Mm-hmm. It's very easy to use. You dip for 20 seconds. You lift it up out of the urine. You put it in the analyzer. It reads it in 21 minutes.
So it's wet.
It's wet urine. Mm-hmm. Wet urine, fresh urine.
Yeah, beautiful. Yeah.
And that result then automatically syncs or Bluetooths into the free phone app for the patient. And as a provider such as yourself, you can see the real-time data in the free provider dashboard. So those providers who want to see this data are welcome to see it in our dashboard, which I'm sure has been super beneficial in your practice.
Yeah. It helps to not have to wait until the patient comes in and pulls out her iPhone. Yes. And we look at it together and I'm on the spot. But speaking to the degree of fluctuation and how that might be a stressor, could you elaborate on that a bit?
So the only time that we're looking for a unique event is the LH surge, ovulation. And so that's where we're very particular about one single data point. But in the PDG, progesterone and estradiol, we're looking for your curves. We know your hormones fluctuate. In blood, they actually fluctuate a lot. And there's studies about that you and I can talk about another time too.
We won't belabor it with our geeking out to the audience right now. So when those fluctuations occur, those are not worrisome.
They're not worrisome as long as you're following a curve or pattern that makes sense. If you see a data point that doesn't make sense, then you have to ask yourself, did you test correctly? Were you dehydrated or sick that could make your urine sample more concentrated than it is generally day to day? Mm-hmm. Was there a situation where maybe you didn't test properly and you oversaturated your wand? Mm-hmm. If you didn't test properly, then that data point would just be excluded. It's an abnormality for that reason. Okay. But if you see, I've done all the correct things, I have no reason to think that my hormone would be abnormal today, then do all of the other data points go together? Then it can be excluded as just an outlier.
An aberrant.
Just like when we have someone tracking temperature, for example, we know that temperature tracking has a place. But if you have one data point that doesn't make sense, you exclude it as an outlier. And you can do that as well with your hormone tracking when one data point doesn't make sense.
Great. That's great. Yeah. And then back to the research, with whom have you partnered? Yeah. Mm-hmm.
Yes. So there's a lot of research out there. Ourselves, we have done, of course, all of our internal studies to show that we're accurate. We have partnered with and done case studies with fertility centers. We're now partnered with Maven and Carrot and Parsley. And we just actually published we put out to the public our effectiveness of conception. And these are based on our patients' quarterly survey results. But it's super encouraging to see how many patients have conceived with Mira and at how many months. And so we have it going up and up. And so there's a lot of research out there, but which specific research do you want to hear about? I want to make sure I'm answering the question.
There isn't a specific, but now I want to put a pin in the recently published or released
public
data, where you're seeing an increase in pregnancy in a certain number of months. How many number of months on average would you say, and how has that changed from the person who was before she was using Mira?
Yes, that's great. I don't know if I'll be able to quote the exact percentages off the top of my head.
That's okay.
But we see at 3 months, 6 months, and 9 months.
Beautiful.
And we break it down based on those regular cycles, irregular cycles, PCOS.
Okay.
And the data that makes me the most excited is the PCOS.
Yeah.
Because we know PCOS general conception rates are around 20-25%. With tracking Mira, it's 53%.
That's impressive. Okay.
Yes.
I'm on my heels. That just blew me away. That's fantastic. Yep. I would love to, if it's possible, get a link to that article so that it can be put in the show notes, because I'm sure that I'm not the only one who just had and I'm delighted to hear also that Carrot and Maven and Parsley, I don't think of Parsley so much as being, strictly, fertility related. It's more general health. But of course, general health includes fertility and menstrual cycles, that they have partnered with you, because while it is lovely that corporations are offering, family planning benefits to their employees, paying a claim is not satisfying. It's a relief. It's a financial relief. But to have the personal attention to who is this person and what is she going through and how can we help her, that just warms my heart in a way that, claims coverage and a new ICD-10 code, diagnosis code, doesn't. I mean, I'm grateful for all of that. It's in the right direction, but I actually had written to a couple of docs, that when the American Society of Reproductive Medicine had put out the statement last summer that for infertility is now a medical diagnosis. On the one hand, yay, because it gives people coverage. On the other hand, yikes, because it then pathologizes something that may not be a pathology. It may just be a lifestyle, an imbalance that needs to be rectified. And this is not I am a big fan of IVF support and egg freezing support. So it's not about this or that. It's about this and that. So very long-winded way. I'll get off my pulpit now. But I'm just so grateful to know that they've partnered with you.
Yes, we know all of that is important. Like you said, it's not an or, it's an and. We are all about empowering the patient themselves and also equipping the provider so they can assist the patient.
Beautiful. And as I understand it, because I listened to your workshop a week or two ago, not only can the provider be of support, but Mira has its own coaching group of coaches. Is that correct?
Yeah.
So you're a coach, but you are a coach at Mira, either as well as or only for Mira. So tell me about the coaching program at Mira.
Yeah, so the coaching program at Mira is a perfect combination of a fertility coach and a Mira expert. And so we blend the two very nicely. Mm-hmm. And so we can be a part of your team. Mm-hmm. We can be with you as you see your reproductive endocrinologist, as you see your acupuncturist, as we see that whole team of people that you have around you supporting you through this journey. We can be key to that puzzle.
Yeah.
And helping you understand your Mira data, interpret it, so then you can have your next conversation with your provider and understand your data.
Right. And truthfully, being a health and wellness coach as well as a doctor of acupuncture and Chinese medicine, they're very different ways of being with a person. And oftentimes what this person needs is really to be looked at, listened to, not diagnosed, but just sort of helped, and as you say, helped along and empowered. And so I think that, rather than wait until your next appointment with your specialist, being able to, in addition to, have this coaching, consulting relationship is key. And sometimes I would say possibly, just start out with that. So you really get your, you get the wheels turning, you get familiar with, so that it's not as though you're signing up for, 9 months of coaching. You could be signing up for one cycle of coaching, and then have the information you need to figure it out, so you're not feeling so lost. Is that how might a person, and I'll put it in the show notes, begin to work with a Mira coach?
Yes, so it's as simple as going to the Mira website, and it's in the place where you can purchase. You purchase either a 45-minute slot or a 20-minute slot. Mm-hmm. Once you've purchased, then you go to the calendar and choose the coach you want, choose a date and time that works for you. And we always say, we have availability in all different time zones, so try to accommodate. But of course, our schedules may fill. So I always tell people, if you don't find a slot that works for you, just check in a couple of days when we add more availability. So don't get frustrated when you're like, oh no, they're booked up. Well, I'm never going to be able to see them. You will be able to get in with us. We'll, of course, add, as our times fill, we'll add more availability so we can get you in.
Good to know. Good to know. And I want to be respectful of your time and the listeners' time. I know, I think that you and I could probably chat far too long, but I also want to make sure that we don't leave without you having conveyed something, that you were hoping to make sure that a listener has as a takeaway.
Sure. Yes. Thank you. So as a summary, what we want to do is equip you with all the tools in your tool belt to track your hormones at home easily, that you can understand them. And I love data, but even if you are not someone that loves the data, you will love how the Mira app walks you through, tells you how to test, when to test, interpreting the data with you. And if you want that extra additional support, you can get a Mira coach to help interpret it with you. But even if you don't do that, you can find a provider such as Susan, Dr. Fox here, who understands your Mira data and can help you along this journey, because it is more important to find your hormone patterns than just a single positive OPK.
Okay, thank you. And thanks for the plug. However, as a doctor and licensed in California, I'm limited to California residents, and I hope that there are listeners across the country and who have someone or know someone or love someone who is struggling. As we know, 1 in 6 is struggling. So I'm going to volley that back to Mira, and then and then you and I can work on if someone needs more. There's more that I can do to help that person as well. So
I think I'll put a quick plug in there that Mira is developing a directory of providers. So if you need to find someone that's in your location, we're hoping to come out with that at the beginning of the spring, so that you can find a provider that's close to you that understands your Mira data.
Great. And I'm going to amplify that a little bit beyond the Mira data to say, please, listeners, if you're struggling with fertility, make sure to the best of your ability that you are really working with a true fertility specialist. There are a lot of fertility coaches out there who mean well, but I don't want you to waste a single moment, a single cycle on someone else's experience and idea that isn't necessarily science-backed. That person may not necessarily have all, and I mean no disrespect, but that person may not have all the education needed for this very specific area of practice, area of specialty. So on our end, and we have a group called the Acupuncture and TCM Board of Reproductive Medicine. I think that's what it's called. The acronym is ABORM.org. And we have self-tested and demonstrated a working knowledge of allopathic fertility medicine and our own, Chinese and functional medicine. So I feel very passionate about that, because that has been probably one of the most heartbreaking things that I've encountered in my 24 years, is someone coming in months after having worked with someone and gotten nowhere, only to discover that, there were things that could have been done. on that happy note, but it is a positive note.
It is a positive and important note. I'm glad that you mentioned it.
Thank you. I'm going to call it a wrap. I'm going to call class dismissed. I do hope that to be able to get you back up for another conversation, because I know we didn't get into the research, but that article will be published, and I think that's of value. And somebody, the listeners may not want to geek out on the research the way I want to. So I'll talk with you once we close the class. Okay. Thanks, listeners. And until next time, class dismissed.